Hey, Off-White Coat listeners, it is my privilege to get to tell you about this sweet deal from our friends over at Picmonic. If you haven't heard about Picmonic, it is a fantastic picture-based mnemonic platform that can certainly help out any student. Most of the videos are around 2 minutes long and provide a quick and effective way to memorize material for any upcoming medical exam. It is extremely efficient. They have this search bar function where you can search playlists on general topics like renal to step 1 to step 2, or even first aid and other books. If you want to review the Picmonic for later, you can even make a playlist of your own. Picmonic even has this repetition algorithm that is spaced out according to your learning needs. This helps with increasing long-term retention and allows you to review the right information at the right time. One of my favorite functions is the quizzes that are associated with each Picmonic. I'll take the quiz first and then learn about the associated pictures and what facts I need to sharpen up on. Honestly, Picmonic is a fantastic tool, and if you use our code OFFWHITECOAT, you'll get 20% off. That's Off-White Coat with no spaces. So what are you waiting for? Make studying the easiest part of your day. Sign up with Picmonic and use Off-White Coat to save yourself some money. Hello everyone and welcome to the Off-White Coat podcast. I'm your host Jordan Abney. Today I'm joined by two special people. The reason for making this show, I wanted to kind of give a rundown of the whole medical journey of a medical student and kind of give everyone some insight on the people that will be treating them in the future and stuff. And these two people have meant a lot to me, meant a lot to the choices that I've made and my reason even to going into medicine. And so I really wanted to share them with you today. They are two awesome people. I'm joined today by Barbara Reese and Thomas Reese, otherwise known as Barbalicious and Old Jim, or as I would call them, Nana and Bubba. These are my grandparents. Say hey, introduce yourself. Or...
Hi, I'm Barb, and I'm proud to be Jordan's grandma.
They're very nice.
And I'm Bubba, Old Jim, or Tom, and I'm very proud as well, too.
Oh, well, flattery all around the board. It won't get you anywhere. But there was something like when I was very, very young, we would always get around the table. And honestly, my grandmother, Barb, I'll call you that for this interview, is a nurse and Tom is a optometrist. So we'd get around the table, and my mom was in medical school at the time, and I was a little kid, and just the stories people would tell, it made me so interested in medicine in general. And Nana, you always had some wild stories about something that would be going on, and it was usually something gross, and I loved it every time. And it really kind of paved my way into going into medicine to begin with. Yeah, so I guess the best way to do it is I want to get a little rundown. I know y'all met at The Ohio State University. That's where you went to nursing school and you went to optometry school, correct?
Correct.
Yes. So paint the picture for me. How was you deciding to go into these respective fields? And, y'all only knew each other for like 3 months before you married. So that's right. Probably it.
Take your time.
You were obviously not making the smartest decisions at that time. No, I'm just kidding. No, I mean, Nana, Barb, we'll start with you. What made you choose nursing?
Well, my mother was a nurse, and I'm a couple years older than you are. So back at that time, it was kind of like all the girls would either go into nursing or teaching or something like that. And so I wanted to go into nursing, but I wanted to go to Ohio State. So that's how it worked out.
So you said that like everybody was going into nursing at the time. What made you want to go to Ohio State though?
Well, I wanted to go to a big school, and I just wanted to have fun. And so Ohio State looked like a good place to have fun.
Because you grew up in Toledo, so it was just, hey, was that the school that everybody wanted to go to?
Well, actually, my parents moved to Toledo when I was in college. So I grew up in Newark, Ohio, which is about 45 minutes from Columbus. And so Ohio State was the place to go. And I wanted to go to college, so that's why I went to nursing there instead of picking a nursing school.
Fine. Tom, to you?
Okay, to me, I started wearing glasses at a very young age, and loved my eye doctor. And I always told my parents that I was going to be an eye doctor when I grew up. I started college at a small Jesuit college in Cleveland, Ohio. I grew up in Cleveland. John Carroll University, and I was in pre-med chemistry major. And after 3 years in chemistry, I pretty much realized that I didn't want to do anything related to chemistry. So I looked into optometry. And at that time, there were only 10 colleges of optometry in the United States. And luckily, Ohio State was one of them, and probably the best one in the country at the time. Probably still is the best one in the country. So I contacted them the summer between my junior and senior year, and went down for an interview. Talked to Herb Moats, who was kind of like the guru down there at the time. And they had a couple spots left, and so he said he'd let me know. And in the meantime, Ohio State was on quarters. John Carroll was on semesters. So John Carroll was starting back, and I just didn't register at John Carroll. Decided that if I didn't make it there, I'd wait a year and get in the next year. But I did get in and spent 4 best years of my life there. We won the national championship in football while I was there in 69 and 68 or 69. Credited for 68, but it happened in 69. And met my wonderful wife there at a party. And
best years of your life were before I was born, I said.
And then when I graduated, she had already graduated a couple of years before I did. And when I graduated, we moved to Atlanta and ended up in Rome, Georgia.
Yeah, how did you end up in Georgia? Was it just the job opportunity that was there?
Well, we decided after we got married, which, I shocked my parents, and she probably shocked hers too, because we met, our first date was around Halloween. I remember we carved a pumpkin, and when I went home for Christmas break, I told my mother I was getting married, and I think her first words were, "Get me a beer, Bill," which is my dad. And she said, "Why don't you wait?" I said, "Nah, this is the one." And so we got married in March over spring break, and when I graduated, where I wanted to go into practice, and the majority of the students at Ohio State were from Ohio. Obviously, we had a few from Pennsylvania, couple fellows from North Carolina, several from New York. But so the majority of them stayed in Ohio. But we decided we were going to go west or south. We didn't like the weather, and so spring break my senior year, we came down to Atlanta. We'd seen a special on TV about underground Atlanta. I graduated in 1971. And it looked like a cool place. One of my fraternity brothers had graduated and went in with a fellow in Atlanta. So we came down and visited Atlanta during one of their famous ice storms. We managed to be here for that. And talked
Made you feel like you were at home in the ice storm?
Yeah, it was like we brought it with us, I think. And we were camping at Red Top Mountain. And we got down here, put our tent up. We didn't have anything too fancy. And then like the next day was the ice storm. So we ended up staying with my friend. So we got ready to go and put all that wet, soggy stuff back in my 65 Rambler station wagon and head back to Columbus, Ohio. But I talked to a couple guys while I was down here that were looking for associates, worked out with one of them, and we got together. And so when I graduated, I came down here, went in with him, which was a good thing. You don't learn a lot about the business end of medicine at all in school. Mm-hmm. And at least we didn't at that time. And so I learned a lot of that, met a lot of people. I stayed with him about 3 years, I guess, and then opened my own office up in the Marietta area of Atlanta. And it was a little slow, so I started coming to Rome, filling in for a guy a couple days a week, and he got ready to sell the practice. And I was really busy up here and not so busy in Marietta, so I closed it down and we moved to Rome and loved it ever since. So that's how we got
the rest is history. Yeah, you kind of set me up for failure a little bit not really, but because I love being a little unique. But I was one of the very few Ohio State fans in Georgia, period. I remember growing up, people would be like, "Why are you an Ohio State fan?" And first I was like, I have no idea. Like when I was a little kid, I was like, "Why are you wearing that shirt?" And I'm I don't know. That's what they put on me. And then when I got older, people would be like, "Why are you wearing this shirt?" And I'd say like, "Oh, just imagine like every Saturday you come and you watch Georgia games." Well, I do the same thing, but watching Ohio State games. And they were like, why? Like, you're in Georgia though. And I was like, oh yeah, but my grandparents went there. And it would just, they're like, I guess, but you still live in Georgia, so switch your shirt. And I was like, that doesn't make any sense. So, but then it got really good because Ohio State, they won the championship when you were there. But since I've been born, they've won it multiple times. Georgia won it this year. This is the year of 2022. Georgia won the national championship this year, but it had been a huge gap in between.
Years,
yeah. So since I've been alive, Ohio State has always been the contender. So they were like, "Oh, you're a bandwagon fan," and I would be like, or like, why? I would get to like brag a little bit, like, "Yeah, we're way better," you know. And I felt great because they were known for choking. And so I was just always like, yeah. And then they'd still be like, why are you wearing the shirt, man? Like, ugh. And I was just like, I'm not going to change you. So I kind of grew up a little salty at first. And then the city of Athens, it really grows on you. Once you get to be an adult and you walk through, you're like, man, this thing recruits for itself. No wonder.
Yeah, it's a great city. And, we've got my daughter Maggie, her husband David, my son-in-law Sean, all graduated from Georgia. So, and
now you're a fan by proxy.
I couldn't root for Michigan when they played them because that would just, that would send me directly to hell if I rooted for Michigan. And so I had to root for Georgia in that. And then it's really pretty easy to root against Alabama. So they've won so many. And I give them credit for as good as they are. I mean, year before this one, they just laid it to us in the national championship game. But, we're still Buckeyes. I still have my Buckeye room at home.
He does have a Buckeye room. I wish we could that might be the thumbnail for this, is just a video of the Buckeye room. There's a lot of memorabilia in there.
And,
you got to be special. You got to have some real football. You got to have some clout to get into the Buckeye room.
There's some pictures of Jordan when he played football at Mercer and at Armurchie High School here. So I've got a few pictures in there of him. And pretty much all my jackets and sweatshirts have Ohio State on them. So, I've learned to, take the beating around here pretty much. But most of my patients, know I'm an Ohio State fan since I have Ohio State in exam rooms and stuff in the office. So,
I mean, at first it was weird because I was different, and then I kind of grew into loving it because of that and just the tradition we've always had. Because while everybody has their game days, we would have our game days here. We would make sure to come. Bubba would be cooking up something, or old Jim would be cooking up something good, and it was always a great time. One question I did want to ask you is, has medicine or like your jobs, have they changed? How have they changed? So I guess you've both been working for how long?
Over 50 years, I have.
50 years as a nurse and
51.
Then 51 as an optometrist. How has it changed?
Oh, well, over 50. A great deal. We used to have a lot more patients. The patients weren't as sick. They stayed in the hospital longer after they had anything done. And now, so much is done on an outpatient basis that used to require patients to stay in the hospital for 3 to 5 days. So our patients are very high-level care as compared to the past. It's kind of an in and out acute care. I work in a step-down cardiac surgery unit and vascular surgery. And our patients are sick. They're a lot sicker than they used to be. You have to be on your toes. You just have to really use a lot more initiative than you used to use in the past.
Why would they be sicker? Like, what do you think makes...
Well, the patients are acutely ill. They're, they're just out of the intensive care unit. They've had cardiothoracic surgery where they've had valve surgery or bypass surgery. A lot of our patients have vascular bypasses with femtip, AAAs and amputations. And so they're in a lot of pain. They have a lot of medical problems in addition to what they're in the hospital for, and they need a lot of close attention.
Do you think that back when you first started, some of those people would not have like where they've had all these extensive surgeries with vascular surgeries and everything, since the technology wasn't there, they would be dead essentially, or something else drastic?
Absolutely.
As opposed to now them just being acutely ill because they were able to rapidly go in there and stent them or something like that.
Yes, because in the past, they didn't do CABGs. So they would have had heart attacks and died. So now so many people are prevented from having severe heart attacks and living a long, higher quality life than we would have used before or experienced before. So there's a big difference. The ratio of nurses to patients has decreased. So you have, if you have 4 or 5 patients now, where when I first started out, you'd have 12 patients, but those patients weren't nearly as acutely ill.
So you would have more or less. They would be less ill, and you would have more nurses.
No,
is that what you were just saying? Or you would have less nurses?
So you had, I would be responsible for 12 patients when I first got out of nursing. Now you're responsible for 4 or 5. But the patients receive a lot more medications. There's a lot more requirements for you to contribute towards their quality of life by doing education and teaching all along, working with the families to support the patients. So there's more expected in your role.
What all departments have you worked in? Because I know you've been working in the vascular unit and the step-down unit for, a good amount of time. But at one point, when I was a kid, you were teaching at a nursing school. So where all have you worked inside?
I started out in orthopedics, and I worked at a rehab hospital. I taught nursing in Ohio. When we moved up to Atlanta, I taught at Georgia Baptist, and then I worked at Grady. When we moved up here into Rome, before we moved in to Rome, I worked at Cobb General Hospital, and then when we moved to Rome, I started teaching at Floyd College, which now has changed its name to Georgia Highlands, and I worked part-time concurrently at Redmond Regional Medical Center. So now I've been at Redmond for over 30 years as part-time and now full-time.
I was about to say, you're not even part-time at this point. You work more than anybody I
work 4 12-hour shifts a week, but I
taught
for years at Georgia Highlands and was director and chair of health sciences there. But I would still work at Redmond, on Friday afternoons and Saturdays, because I think it's very important to keep current and knowledgeable in your field in order to teach students and to teach them, what is current and what kind of expectations they should have upon graduation.
That's a brilliant outlook, because I know a lot of girls that graduated with me, they only keep up with me because they know you now, because they're working in the hospital with you. And they've said that you've taught them so much, not only about medicine, but it was the work drive and how to operate. They were like, well, we got to keep up with Barb all the time. And that I can definitely attest. They said that they've learned a lot from you and they've really enjoyed being around you. And if you were just in the teaching side, not actually in the hospital, you might not have had such an impact, but you really have. And these people, they've got to be 30, 40 years younger, I assume, right? Something like that. Yeah. And they see how you're working, and you're able to help them progress to be the next generation or next. So that's one thing for sure. All right.
Well, she did forget one thing. Several years ago, she got it was a nationwide award at Redmond, which was an HCA hospital for mentoring. So she won the local award, went into regional, and then she won the national award for it. So it was pretty impressive. So they sent us to Nashville, and we had a good time there. So she did forget that.
Yeah, she's very humble about all of her awards. Just talking about the dedicated work experience. No, yeah, so things have changed, because how has things changed just acutely over the COVID this year because of COVID? Has it changed drastically compared to the 50 years that you've seen? Or is it kind of just, does it fluctuate back and forth?
We've been in masks, hats, and shields for 2 years now. And it's getting old, to say the least. But, it's something that's necessary. Right now, there's an up curve in COVID. Most of the people, though, that are truly sick and having to be hospitalized are ones that are unvaccinated, and it's just a shame. A couple of the nurses that I knew and worked with for years have died from COVID. So, that's pretty sad. But a lot of people are overworked and strained. Our hospital, as well as Floyd Hospital, where your mom works, they're overcrowded. Like our census is 230, we have 270 in the hospital. So they've opened up other areas, like outpatient and areas in the recovery rooms where, like pre-op, they're housing people in beds. They have patients in hallway beds in the emergency room. So it's a challenge.
Has the COVID restrictions, like I guess it's just, the masks and everything, has that put a strain specifically on like your unit? I guess it wouldn't cause an uptake of patients, but I guess it could slow down the way you're able to treat or see people. I don't know if that has affected it at all. The
COVID patients are housed on separate floors to the extent that they can, or in separate areas. So it hasn't affected us that much. We have one COVID patient on our floor right now that had an open AAA, and then he developed COVID afterwards, so he's been staying on our unit. But the other patients that may develop COVID in the hospital are usually transferred over to an area that has COVID.
Okay.
So it's not that much, but everyone has been wearing masks, and so you can't see each other's facial expressions, and that may have somewhat of an impact on patients when you're caring for them.
Oh, certainly, yeah. I definitely think that, I think that humans in general, we really have learned to read each other's facial expressions too. Like that's kind of the whole point. And when we can't, it's hard to... It does help, though, sometimes if there's a bad smell or something funny happens. If someone says something ridiculous and you're like, so glad I was wearing my mask for a second there. But you can kind of just, originally when you would just stare at them like with a stone cold face, you're kind of able to like, oh, okay. That's the only silver lining. But yeah, so Tom, how has it changed over the course of your years?
Well, now you get to meet the slug of the family. 'Cause I don't work 48 hours a week, but
retirement. Yeah, still hasn't retired yet, but it's reduced his hours.
Yeah. Well, one of my grandsons said I don't have a job, I have a hobby. But now I work 3 full days, 2 half days a week. So I've cut back a little bit. But optometry itself has just changed dramatically from when I graduated from school in 1971. At that time, we couldn't use any medications at all. We couldn't use any diagnostic drugs or therapeutic drugs. So we had different ways of checking the pressure in the eye and that, which worked, but it was a little more difficult. And I'm proud to say that I was in my early years, I was on the forefront of getting the Georgia Optometric Association started on a course. Optometry in Georgia is a legislated profession. So we had a bill in Congress, in the legislature, for the use of diagnostic drugs. And a good friend of mine was a professor at the time and eventually dean at Mercer University Southern School of Pharmacy. And so we got a course set up for the optometrist in Georgia and approved by the legislature, and we took it and passed it. And so we were granted the ability to use diagnostic drugs for dilating eyes, checking the pressure in the eye, things like that. Several years later...
sorry to interrupt you, but so did you have to go to an ophthalmologist then for...
If you wanted to be dilated,
to have just your eyes dilated? Oh, okay. Because that seems like it would be a whole stretch to go see you and then go all the way over.
The majority of people don't need their eyes dilated every time they have their eyes examined. Mm-hmm. Number one, most kids and most anybody that's nearsighted already has pretty doggone big pupils, so you can usually see in there fine without having to dilate them. Certainly high myopes, people that are very nearsighted, diabetics are very prone to problems in the retina, so those you really have to dilate them every time. But
every time? Yeah. Okay. So if you were like, let's say 50 years ago, when you were a diabetic, you would have to go to an ophthalmologist every single time to get just your regular vision.
Yeah, just to have your pupils dilated so they can look inside. So several years after that, we got had a therapeutics bill in the legislature. We took a course through New York College of Optometry, and the payoff and paying for that and taking it was he got to go to New York to do some clinicals and take the test at the end of the deal. So we've added that. We've also added a glaucoma treatment so we can treat glaucoma. And now with therapeutics, you can take care of abrasions and, allergic eye conditions and corneal,
ulceration.
Corneal ulcers and things like that. So
I remember I scratched my eye once, and you were able to give me a little medication.
Drops, yeah.
Yes. Oh my God. It felt weird though, because my whole eye would be numb, and the part where it would run down my nose.
Oh yeah.
And so I was just like, and that's like, oh wait.
And now they've added injections, so we can inject chalazions and things like that. Again, you have to take a course.
Chalazions are the ones that are on the underside of the eyelid.
Yeah, they can be under, they can be on the. And I have not taken that course yet. I don't think it's probably going to be something I do at my stage of my career, but I can always send them out to somebody else if it's something. And you don't see a ton of those anyhow. So it's changed dramatically. And, day to day, the patients are so different. We joke about it at the office sometimes about, one day it seems like everybody who's really nearsighted, highly nearsighted, every patient you see that day is like a -9 or something, Mm-hmm. And the next day, everybody has 3 diopters of astigmatism. And they seem to come in bunches like that, or you get, 4 or 5 hard contact lens wearers, and you don't see many of those anymore. Mm-hmm. They're kind of a dying breed. And right now in Rome, we're about the only ones who fit contact lenses anymore, so we do a lot of contact lenses.
Yeah, I remember everybody that I would talk to, while they might rip me about being an Ohio State fan, went to you as their eye doctor. Like, there would be very few people that were like, Tom Reese I know him. He's my eye doctor.
So it's changed dramatically. I love what I do. I love talking to my patients. And a lot of them I've seen. We still get a lot of new patients, thank God. And there's some challenges with, we get a lot more Hispanic patients now. And I have...
How much Spanish can you speak?
I can do an eye exam pretty much in Spanish now.
Hey.
And not from taking a course to do it, just from, a lot of them will bring interpreters. So I'll listen to what they say. I'll say something, they say something. Mm. So I pretty much know what they're saying now. When I was in high school and college, I took French, and I've yet to have anybody from France come in and
I remember.
I don't speak any English. No. And I probably couldn't do that either because it's been so long. Or anybody in Latin. I had 4 years of Latin in high school. That hasn't helped me a bit. So it's changed because we get a lot more Hispanic patients now. Mm-hmm.
Do you have a translator line that you can call? Let's say
no, we just tell them to bring somebody with them. If
Oh, okay.
And if not, I'll get by.
Yeah. I mean, I guess now I can show you later, but you can use your phone, and they can speak into your phone, and then you can read it. Yeah, that's what. Yeah. So it's the best way to handle it in the hospital.
So there's everybody's different. There's all kinds of different patients out there. From red eyes, and they could have a retinal detachment. They could have some type of trauma to their eye. Sometimes you can have broken bones, get hit in the eye with a softball or something like that, tennis ball, and have a fractured orbit and things like that. So you see it all. Everything, even brain tumors. I picked up several brain tumors through the years. And people...
How do you see a brain? Okay, carry on. What were you saying?
Oh, go ahead. But the brain tumor, usually it's the optic nerve. There'll be, I can remember it's been years ago, I had a young kid came in, and his dad brought him in, and he's complaining he couldn't see, and we checked him, and we couldn't make him see real well. And then I looked inside, and his optic nerves were all swollen up,
so blurred, and
disc margins were blurred. There were some hemorrhages. So I got his dad, and I said, we need to send him over to the neurologist to find out what's going on. This isn't normal, and that's why he can't see. And his dad was, he's okay. And I said, no. You need to follow this. And he ended up having, luckily, it was not a malignant tumor. So he had a tumor, had it removed, and did fine. And after that, but...
So it would be like a sign of, I guess, intracranial papilledema?
Yeah.
Is that what you're describing?
It's just pressing on the optic nerve or the optic radiations or somewhere back through the brain.
Which to people, I guess, in the medical... You described it best. Then I just wanted to make sure I knew exactly what you were referring to. But yeah, he can look in the eye. It's the best way to describe it. And he can see all the nerves and the blood vessels and everything. And then sometimes that nerve can get blurred in the image, and you can kind of see. And
the eye is the only place where you can actually observe blood vessels without having to use a dye and all that stuff, because you can look directly at the blood vessels on the retina, and the eye has a large blood supply, and diabetics are very prone to retinal problems because of that, because diabetes affects the blood vessels, and affects the blood vessels in the eye and the heart and the kidneys and things like that. So because they're all highly vascular structures in the body. So people ask me all the time, when I'm going to retire. And I said, well, I don't know. I said, I just renewed my license. It's good for at least a couple more years. And my kids will say, why don't you retire? And I said, because I don't want to. I enjoy getting up and going in every day. Some days may be better than others, but it was funny because I came home a couple of weeks ago and I told Barbara, Nana, I said, I heard a song. I got it on the radio in my office and I listen to country music, and it was Garth Brooks, "Standing Outside the Fire." And I said, that's it. I don't want to be outside the fire. I want to be inside the fire. I want to be relevant in life. If I retire, I got nothing to do, and
especially when your wife is always gone at work.
Yeah, she's over, and when she's home, she reads. So, but I don't have any big hobbies. I used to play golf a fair amount, but I don't do that anymore. And I can't. I'm not a woodsman. I can't work with. I'm not a woodworker. So, and I enjoy my staff. We have a good staff. They're very knowledgeable about things, and I've got a great tech. Helps me out a lot.
I grew a lot of respect for you because I would do the eye exams when I had ophthalmology rotation. And so they would go do it and they'd be like, yeah, okay. Jordan, you want to look? And I was like, oh, yes. Because sometimes I would just sit there and I would just watch them look into other people's eyes, and that was about as exciting as watching. Yes. I'm like squinting like I could really see. Like, of course you can. But I had to make it look like I was paying attention. But then I would get in there and I would get to operate, and then I would be like, they'd be like, oh, you see it, right? I could see like something of a resemblance of what I thought I was supposed to see, but then it never was like perfectly clear until after a while I realized that I needed to do some adjusting of the machine. I was like, oh, okay, like I'm doing this all wrong, but I just didn't know how to do it. I was like, I grew so much respect because I was like, and then I like flipped the light on, and then I was like, I think I'm supposed to. They're like, yeah. Does it look normal in there? And they're like, yes. I was like, okay, yeah, it's fine. Yeah, they're great.
I agree.
Yeah, they would leave the room, so I'd just be talking to the people and like doing it. But the whole time I was talking, they didn't realize that like I was useless in there. Besides the talking part, just keeping them calm.
I know your mom. She's come over to the office a couple times, wanting to be able to look inside the eye and see things better. And she spent a day or so with me a couple times. And I said, if you don't do it every day and look in the eyes every day, it's pretty tough to be very good at doing it. If you do it once a month, you're probably not going to see very much. If you do it every day, it becomes rather easy to look in there and see what you're supposed to see, pick out what's odd and unusual and things like that.
Yeah, I had when I was in my internal medicine rotation, we had this mentor, and he would come and talk to us just about like what we should do in certain situations. He had already retired, and he would just tell us about we'd talk medicine essentially. It would just be a roundtable discussion of medicine. And in almost everything, he would say, oh, did you check the retina? Always be like diabetics, or like if they had like kidney issues or anything. He would be like, oh, and then there would always be like some retinal reason that he would have been able to diagnose one of the conditions. Like the kidneys, once they start seeing eye changes, diabetics, once they start having eye changes, usually they'll start having kidney. And that's why it all started with that. But then he would always ask that. And none of us had ophthalmoscopes at all on us. So it was never an option for us to check the eyes at all. Like, I guess we shine a light at, there was never, so he would always ask us and be like, oh, you should have checked it. And we were like, maybe, we knew, but even then I laughed because then I did the other rotation after that. And I was like, I would never have been able to, it's very difficult when you don't know. I mean, you can kind of figure out what you're doing, but it's not very clear cut. You definitely want an optometrist or an ophthalmologist not me looking in your eye.
Yeah, if you don't do it all the time, you're going to have a tough time seeing things.
So another question, since you enjoy it, how do you avoid the burnout? Do you know what I mean by burnout? I figured everybody in medicine should.
Right now, I've reached the point where, sometimes when you're younger and you're pushing it and I worked a lot harder and when I was younger and more days and things like that. Right now, we just, got to the point where we, take vacations and get out of town for a few days here and there and relax. We got 13 grandkids, so we get to go see them and watch them play ball. And so, you just, don't take things too seriously,
Find other ways, yeah.
Yeah, just relax when you're not there.
That's an awesome view. We are very convinced as grandchildren that the reason y'all have continued to work over these years is because you have to pay for the trips. So it's a continual cycle, you know. That's how you avoid burnout, but you're never going to get to escape because they like their artwork. No, I'm just kidding. Nana, or Barb, how do you prevent burnout?
Well, I just haven't felt it at all.
Never?
No, I really haven't. I guess it's because every day is a new day. It's not the same thing all the time. You can be at work and it can be just a real busy, real hard day with rapids or codes or whatever. The next day can be entirely different. But like Tom said, we try to plan at least a long weekend away once a month. So we've got our vacations planned, and there's always something to look forward to. And we enjoy traveling with each other, and we love it when we go along with our kids and our grandkids. So it all works out very well. And I get paid. I get PDO when I leave. So.
Ooh. You were smirking pretty hard when I was like, she's either smirking because she's thinking of the hospital or she's smirking because she thinks she's thinking of the vacation.
That's right.
And I was like, we're going to have to flush that one out. But it's pretty clear now. Since we're on that topic, where was your favorite place to visit? Because y'all been a lot of places around the world.
We like St. Croix and we like Key West a lot.
Yeah, one trip we took that I just remember a lot about was we did a Amtrak trip. It was called Route 66 by rail, and we started in Chicago, ended in L.A., and we went from Chicago to St. Louis. Spent a couple of days in Chicago before we left. Got to St. Louis, spent a couple of days. Went on to Albuquerque, spent a couple of days there. I think this was a 2-week trip. And then we went on to Williams, Arizona, got off the train there, and took the Grand Canyon Express to the Grand Canyon, and spent a couple of days there, came back to Williams, got back on the train and stayed on it overnight to Los Angeles, spent a couple of days there and flew home. And it was just a great trip. We got to see a lot of the country, and especially when you're riding on the train, they have the great observation cars that you can sit in. I love trains, so, that's one. And we did a Mediterranean cruise. That was fun.
Yeah, that's one thing me and Mary Beth are very, very interested in is international travel. I love to go see other people's cultures. And while there's definitely different cultures all around the U.S., it's just drastically different everywhere else you go. And, but it might be a little bit more difficult now, like in the next upcoming years and everything with COVID or whatever restriction. I don't know. That's the only thing that stinks is because that's one thing that I enjoy more than anything is kind of
we were supposed
bouncing
to
around.
Be leaving tomorrow on a Hawaii island cruise, and that was canceled. We've been to Hawaii before a long, long time ago. Another thing we're doing this summer, and either the summer or fall, is a Great Lakes cruise. That was my idea. I grew up in Cleveland, Ohio, and we only lived a few blocks from Lake Erie. So, the lake was a big influence growing up with fishing and all that stuff. And so this covers all 5 of the Great Lakes. So I'm looking forward to that.
Nice.
So, but, it's just,
You got to see the world.
Yeah, we've covered I've got about 4 or 5 states that I haven't been to. And outside of that, we got the rest of them covered. So.
Mm-hmm. Yeah, that's also something that I guess blossomed a love for travel as well as y'all have never been afraid to go visit anywhere. And so that was kind of looked up to y'all in that aspect as well. This next question is for you, Barb. Okay, so because a lot of these students, or a lot of the people that might be listening to this might be like medical students or people going into it, the best question would be, how is communication with physicians? Has that changed differently? Or is there specific physicians that you're able to communicate better with? And does that help patient care at all?
I think there is a difference. I think there's more of collegial relationship than there used to be in the past. One advice I would give medical students and residents is come up, talk to us. And they do that a lot in the hospital. They'll come up and ask how the patient's doing. They'll want your, input on what's going on with them and that kind of thing. And to communicate on a regular basis and kind of show interest in, what you're doing. If people are talking to each other about what they think is going on with the patient, you get a better view and people can kind of carry on a plan of care that's more, I think, more well-defined, I might say, as far as and well-rounded for the patient.
Yeah, I will say, when I was in internal medicine, when you go onto that floor, and then you go and let's say you're looking for a chart, and you go and you walk right past all the nurses, and it felt so weird. And I will say something that changed drastically is at first I kind of didn't know what I was doing at all. Like, they were just sending me, go down to the 4th floor, grab this chart, put this sticker in there, roll, like, and half of my time there was me just like walking around, like, looking for a nurse or looking, but when I would meet that nurse, I would just try to be polite. And then I would be like, hey, if you need anything, let me know. I got your name now. I would introduce myself, which is something I don't think necessarily every one of the medical students did in my group. But I will say that after a while, like maybe after the first couple weeks were still a little like touch and go. But after I started to know people, and then I could come in, and it was a lot more relaxing, and they helped me out a lot. Like, you see me walking around, they're like, Jordan, it's over there. Like, I can already tell you whatever. And I was like, oh, thank you. Even then, I saw the utilities of at least befriending and getting to know your whole team, because a lot of people would just like ignore that, and they would just let them fend for themselves if they were ignoring or being, in weird or whatever. And so I always tried to be, I guess, at least candid and polite. And it went a long way. I remember when I was in the ER, a lot of the nurses, one nurse was just super nice. Like, she was just really polite and was like just teaching me a bunch of stuff, like how to put the leads on patients and stuff. And at one point during she was just like, oh, you don't know this? Like, Jordan, come on over here. Like, and I was just being polite, and she was showing me things, and I was like, I wonder if I'll ever need to know this or not. And then 2 weeks later, somebody goes down, the nurse was gone, and one of the doctors was like, where do these leads go? Like, somebody put the leads on the patient. And he looks around, there's no nurse. And I was like, I know how to put the leads on the patient. And then he was like, let's go. Let's do this. And so I was like, okay. And so I just did exactly what she had told me. And then right around that time, a nurse had walked up, and he's like, it was just a good moment, because then everything just worked a lot smoothly. And I was like, oh, it's a good thing I was like just listening to what she was saying instead of ignoring what she was saying. Mm-hmm. So yeah, that communication is key, I would say. Is there anything that you could think of that could improve communication?
I don't know. I think we're doing a better job at getting together and having meetings. Like on our floor, they have a meeting once a day where the social worker and the physical therapist, the physician and the nurse, they're all caring for patients. It's kind of a quick run through on what their problems are and what we need to focus on and where do we need to go from there. And I think that's a good thing to do. But to medical students, like you said, it's important to communicate with people and say, hey, what's going on, and ask each other what what's going on with the patient and where do we need to go. Because, like lots of times maybe somebody will come up and I'll tell him, well, he's got some wheezing in his left lower lobe, and he's had some trouble with this or that. And so I think they appreciate that. They'll go in there and listen to the lungs themselves and talk to the patient about the problems they've had. And it seems like the patient is better satisfied too, because they know that communication is going on.
Yeah, I definitely think that communication is one of the keys to at least improving the whole patient stay, like even improving the patient's view on the stay. Let's say everything went successful, but they didn't feel like they were heard or anything like that. That can still make a patient feel like it was not a very satisfactory trip to the hospital. Mm-hmm. But yeah, okay, so you went to a bunch of different departments. You went through that before, and I thought of this question, and then I forgot to ask it. Mm-hmm. Which one was your favorite, and which one did you dread working in? Or did you ever dread working in a department?
My favorite, I think, is where I work right now. And I really enjoy that a lot. The one I dreaded to work in, I think, was when I had students in the rehab unit at Grady. And there just wasn't a lot of communication between the nurses and the students and myself as an instructor. It seemed like they were so separate that, you didn't feel like you were welcome and that kind of thing. So I knew I didn't want to work on that unit.
Okay. We apologize for any heavy breathing that you hear in the background. That is not Tom. That is the dog in the background. He's a little ball of fire, a lot of energy. How do you feel? I guess this is a good question to ask you, Nana. Like, how do you feel about the recent switch to? I know a lot of nurses, including my uncle or whatever, but they're trying to do the travel nursing, and I know that's become very popular recently because of the amount of money that can be made.
Well, we've had a lot of travelers on our floor, and the problem with travelers is that they don't know the doctors, they don't know the preferences of the doctors, they're not as familiar with our procedures, so to the point where I have to make assignments for the next shift coming on. We're not supposed to give traveler nurses the patients that have had open heart surgery, valve surgery, VATS, and those kind of patients. Well, that's what our floor is pretty much made up of. We have a few other little, other things, but it's very hard to make assignments. And then there's a heavier load on the nurses that are used to working on our unit and comfortable with those kind of patients, because you give them the very hardest patients that are on the floor all the time. Plus, the travelers don't know what to do for this or that. So as a charge nurse, you have to pick up that. So one day I discharged 7 patients, admitted 8, I think, because they don't know or they aren't comfortable with doing that sort of thing. And you don't want them to miss things like you want to make sure a patient gets Coumadin education before they leave. They wouldn't recognize that as a need to do prior to. Or if a patient has had bypass surgery and on weekends the education nurses don't come around, so you have to make sure you teach them all about their precautions and things to look for, and have their family member that's going to be with them for 24 hours, 7 days a week for the first 2 weeks, understand all that stuff. So, it is a bigger burden on the nurses that are working there, employed by the hospital, plus they get less pay. We've lost several nurses that have left that have been good nurses that have gone to do travel nursing.
Okay. When you get a travel nurse, let's say in the vascular unit, are they usually working in the vascular unit and that's what they're traveling, or they came from, orthopedics and that was the best paid, gig, so now they're switching and doing a whole new specialty?
Well, usually they're med-surg nurses. Most of the travel nurses are pretty good, but some are bad. So they don't necessarily have our kind of a background. Mm-hmm. They may have worked in acute care, but it may be in a kind of a different area. They don't have the sick patients that we have.
Okay.
Maybe they work with heart patients, but they've been stent patients. They haven't been, cardiothoracic valve patients.
Okay. Yeah. So I guess because it is a tricky situation, especially because COVID's kind of exacerbated that too, because some nurses would go down, so they'd need to bring in travel nurses, especially at the, I guess, more up north and stuff like that. I know a lot of the nurses that were in the ER that I was rotating in, decent amount of them were travel nurses. Now, a lot of them weren't, but then there was a weird, dynamic even between that. So it's just a weird time, I guess. Okay, we're going to have to wrap this up relatively shortly. We've hit about an hour now anyway. It has been a pleasure, but I did want to give you all the chance. Do you have a funny story to tell about me, I guess, or anything? You can, while I guess anybody listening, you can humble me a little bit. You've been around, you've seen me at my best and worst.
Well, I remember when we were taking a vacation, I think we were down in Miami or Florida someplace, and you were little. You were just a few years old, and you were swimming around in the swimming pool with one of those little tubes on, inner tubes on. And so I was going to go out and I was going to get biscuits for us all for breakfast. And so I came to ask you, and you had this little girl you were playing with in the swimming pool too. And I said, well, what do you want? What kind of biscuit do you want, Jordan? And he said, I want a gravy biscuit. I mean a gravy biscuit, not a sausage and gravy biscuit. I want no sausage on that biscuit. Well, I knew he knew what he wanted at that point.
Yes, that I still recall that Bojangles would throw the sausage on those biscuits even still. Let's just say I was pretty fat as a child, so that was the highlight of the year, was the gravy biscuit.
And then there's the time that he slept with us.
Yeah. I was like,
There
leave the
was
floor, I'm
one
gonna get roasted.
summer. I'm trying to think. He might have been.
Last year.
No, it wasn't last year. Maybe 6 years old, 5 years old, something
Yes,
like that. And he spent a good deal of the summer with us. We lived out in the country. His mom was working in Atlanta, I think. So he'd come and spend most of the week with us. And we had lots of places to run around and play. We had a swimming pool. We had a lake to go fishing. But anyhow, he'd always sleep in bed between us. So he was in bed one night, and I was asleep, and I woke up, and I thought, it's kind of wet in here, you know. And I get up, and I pull the covers back, and right under Jordan's this big wet spot, you know. And so I wake him up and said, Jordan, he said, I didn't do that. I said, but he's right underneath you, buddy. Don't worry about it. We'll get it changed out here. So I still remember that. But it was always fun to, we've been blessed as there were 13 grandkids. Jordan's the oldest.
Yes. And, so they realized not to let people sleep in between them early in the course.
But, as we said at the beginning, we're proud of him for what he's done, and he's just a good guy. Just,
He's a pleasure to be around.
That's right. It's not just that he's in medical school, but he's just a good guy.
I appreciate that. I guess one more thing though I did want to bring up. I see it on my. So y'all went to Grenada. You came to my white coat ceremony, and then y'all went and explored the whole island. A lot of the people that listen to this have heard about Grenada. What was your thoughts on the island life? Whether they
we rented a car and.
Bubba, he went to Seven Sisters. He saw some waterfalls.
And on the way back, I was talking to a guy on the airplane in the bathroom line, and I think his daughter was down there. He'd gone down for the white coat, and I said something. I said, "Well, we rented a car." He said, "You what?" I said, "We rented," because the roads were just horrendous. I mean, they just were horrendous. But
one red light,
and we had Mary Beth and Barb and I. We went up to the top of the old volcano where there's a lake in the middle of it now, and it was very pretty. It was kind of a treacherous drive up there. I mean, about every 50 feet, you'd see where a car went off the road and crashed, and they hadn't bothered to clean it up, you know. Mm-hmm. But we got up there, and then we saw this sign that said Seven Sisters Waterfall. So we went down there, and this old guy came up, and he probably wasn't that old, but he looked old anyhow. And I said, well, how far is it down to the waterfall? And he said, well, it's about 20 minutes or so. He said, but I don't know for the, what was the term he used?
Old people.
No, the
elderly?
Elderly or something like that. Because I was debating whether I really wanted to go down there or not. You were in a rainforest. It was hotter than hell. But when he said that, I said, oh, well, yeah, I'm going. And that was the wrong decision to make, because it was a bear to go down there. And he kept saying on the way down, he said, oh, coming up will be a lot easier. And I'm going, well, you know, I wasn't born at night, but I was born at night, but not last night. Coming up can't be easier than going down, you know. So we got down there and we saw like one sister, because the rest of it you had to climb a mountain to go see. And so we started back up, and it was all muddy, and so I slipped and fell down. And this poor guy went crazy. Okay. And I said, I'm okay. He said, get up. I said, let me take a break. I said, I'm fine. I didn't hurt anything. I'm just getting my breath here, buddy. So I slipped in the mud, but anyway, I got up. And at that time I thought, what if I did slip and fall and actually break something? Would they just left me there?
You'd been like one of those cars.
Yeah, because it was like, you know, they didn't have any medical facilities on Grenada that I ever saw. This guy weighed about $105, and I knew he wasn't going to carry me out of there.
Well, he was too busy smoking his weed.
Yeah, he was. He'd stop.
Your tour guide is...
Yeah, he'd stop for a break every 15, 20 minutes or 10 minutes, and he'd kind of get back away from us, and he'd be rolling something up and smoking it. So, but I got back out anyhow, and I thank God. I said, I'll never do that again. I think every inch of me was soaking wet, so...
We had a great time there, though. I love the containers for food.
Oh, yes.
The school was beautiful.
And that one bar that we went to.
Where the coconut tequila or whatever.
Yes. And it was outside. Yeah.
I mean, it was the only brewery on the island, so we would call it the brewery.
We had a great time.
Yes, a lot of Grenada, at least, I mean, most of it is you're doing something that you're like, why am I even doing this? And then you get to the top, and then you're like, wow, this is one of the most beautiful sights I've ever seen. Like, and then after you get done with this experience, you're like, wow, I'm surprised I didn't die halfway through any of this.
When I slipped in the mud and went down, I thought, God, if I broke something, none of the people there, they all look like they weighed about $1.05. But Grenada
great times.
Grenada was a great time.
Yes, so we're going to wrap this thing up. It has been such a pleasure to talk to y'all. I love y'all. I hope everybody listening has enjoyed it. Y'all have been my role models ever since I was a kid, so I'm blessed to have y'all as grandparents. Thank you for at least chatting. Y'all have been great. And thank you, everyone, for listening. Go Bucks, and we out. Oh, yeah, OH.
I-O.
We out.
Hey everyone, I want to take this time to tell you about our friends over at TrueLearn. They have this top-of-the-line test bank that is perfect for any upcoming board exams that you may have. They have test banks for all types of exams. So whether you're studying for medical school, nursing school, OT, pharmacy, and others like speech pathology, TrueLearn is the way to go. If you're like me and going through medical school, they have question banks for all the big exams, like Step 1, Step 2, and Step 3, with quality assessments for each exam. Look, I know we didn't go into healthcare because we love taking tests. This is the hard part of the job. Make it easy on yourself with TrueLearn. Sign up now with the code OFFWHITECOAT to get $25 off your purchase. That's OFF white coat, no spaces, to get $25 off your purchase. This is a test bank that you do not want to pass up on. Make this easy on yourself. Take the deal, pass your boards, and get back to enjoying the reason you went into healthcare. And make sure to use OFF white coat